Amber, thank you. This month marks 3 years since the nationwide shutdown because of the COVID-19 pandemic. News 8's Jeremy Jenkins joins us live from UPMC in Harrisburg. Jeremy?
Well, Lori, 3 years into the pandemic, COVID is no longer a scary unknown. We're learning more about it each and every day, but it has permanently changed how we interact in certain environments to how people are even getting sick.
Today we have 28 patients who are hospitalized with COVID across 7 UPMC sites in central PA.
That's a much different picture than what we saw at this time 3 years ago.
I am ordering the closure of all schools, community centers, gyms, and entertainment venues.
When then Governor Tom Wolf shut down non-essential businesses in the Commonwealth in March of 2020, the Susquehanna Valley had hundreds of COVID cases. One of the largest impacts that we're still seeing today, the burnout of healthcare workers who are overwhelmed with patients.
Some of the people who quit at that time are also coming back now. So hopefully in the near future, every administration is making efforts to recruit more people, train more people. So that should be improving.
As more workers are making their way back to the healthcare field, the environment will be somewhat familiar with procedures like masking and social distancing still in effect to prevent the spread of COVID and other respiratory illnesses.
We are seeing a lot of flu during the fall and the winter. We saw a lot of flu patients, so that also prevents the spread of the flu. So we're still wearing the mask.
While COVID has become the new normal that many predicted it would be, Dr. Brar says one thing has remained the same when it comes to patients.
Interestingly, patients who are hospitalized with COVID even now, and as well as what last year was, most of them are patients who have not been vaccinated.
When it comes to protecting yourself, Dr. Brar says you should always talk to your primary care provider about vaccinations. When it comes to everyday things you can do, she says you can wipe down common surfaces and make sure they're disinfected. And when it comes to coming in contact with people who may be sick, make sure you keep your distance. Back to you.
All right, thank you very much.